Fear and anxiety. These play a very large part in how well a woman will cope in labour and having a baby. Feeling as though you have some kind of control over what happens to you during your birth will help. The search for perfect pain relief in childbirth has come a very long way in the last 50 or 60 years. There aren't that many things that we can use that are safe for women, but the things that there are all have benefits and disadvantages. What we want to be able to do is to explain what the options are and how they might work for you or not work for you. Pain during labour and birth is caused by the opening, the stretching and pulling of the cervix and the contraction of the womb, of the muscle of the womb. Most of the pain happens around about the cervix, in the lower part of the womb, because that's where the stretching occurs. We have pain so that we are aware that something is happening. Otherwise, you could be walking down the road and your baby could fall out without you noticing, which happens on the television, but it doesn't happen in real life. Learning how to manage the discomfort of early labour and active labour is one thing that will reduce your pain. You have several options for managing pain, and you can start with a ladder of pain relief. You can start at the bottom of the ladder with simple things and work your way up to more heavy pain relief when you need it. Support is very important, and we know from research studies that the better the support you have of someone that you trust and someone that you know is going to reduce the length of your labour and make birth easier. So having a support partner there, whether it's your own partner, your husband, a birth partner, your mother, or the midwife that you know, will reduce your pain in labour. Activity and distraction. Using distraction as a way of managing pain is actually very useful and works really, really well. So doing things that will stop you from sitting and thinking about the pain will help you feel it much less. So going out for a walk, watching the telly, doing something interesting, even going shopping if you're in very early labour. Anything that will make you forget about what's happening in your body is quite a good thing to do. Being relaxed in labour, which you can bring about through learning how to do relaxation techniques or going to pregnancy yoga classes, as well as knowing what your body is doing, will help you to be more relaxed. When you're relaxed, you have much less adrenaline in your body, which makes your muscles much less tense, and it also helps you to produce a lot more of your labour hormone, so you'll have a smoother, shorter labour. Water. Using water in labour is very relaxing. Using water when you have any kind of tension and muscle pain is very relaxing, and labour is no different. It helps to reduce your adrenaline, relax your muscles, and again will help you to reduce pain. Massage is something that a lot of women find really, really helpful and comforting in labour. It's a way of communicating with your support person without having to talk, which is often quite difficult when you're in the middle of labour. And it also reduces adrenaline. Using aromatherapy oils during labour is something that you can do, but only with the guidance of a qualified aromatherapist. They're very useful. Again, it's a sensory thing, and using smell, like using touch and using communication, is one way of helping to reduce labour pain. If your partner learns to do acupressure so that he can support you in labour and help your labour to progress by using certain points on your body, this can be used for labour progression or also to help with pain relief. TENS. That stands for transcutaneous electrical nerve stimulation, which is a very long word, which is why it's called TENS, just so that you understand what it is. A TENS machine works on two principles. It helps to reduce how quickly pain messages get to your brain, and it also helps you to release endorphins. It works in a similar way as massage as well. You may find that it's very, very helpful for pain relief, or you may find that it's just a distraction technique. Moving further up our pain relief ladder, you may find that you've exhausted all the simple options for pain relief, and actually what you want is some drugs. And for this you will need to go to hospital. Gas and air. Most people know it as gas and air. It's also called Entonox, or laughing gas is the other name you may know it by. You may have had it at the dentist. It's a very simple way of helping with pain relief. It's a very good one because it's controllable by the person that's using it. And it's completely non-harmful to the baby and to the mum. Using injectable drugs for labour pain. We have only two options really. There aren't many drugs that women can have when they're pregnant that are analgesics, that are injectable. We have pethidine and Meptid. These can have an effect on the baby, a slight effect because they do cross the placenta. Meptid not so much, pethidine definitely does. It's something that you can only use a couple of times during labour, and it has what we call a half-life, so it'll work quite well for half of the time, and then it will work not quite so well for the remainder of the time before you can have any more. With pethidine, it does cross the placenta and can make the baby sleepy as well. So although we give it to women in strong labour, we try not to give it to them too near delivery of the baby in case the baby comes out, and it can depress their breathing a little bit. And sometimes they need an injection to reverse the effects of that. For women, it does make them very, very nauseous, so most hospitals will give you an injection of anti-sickness with the pethidine. Moving to the top of our pain relief ladder, we have epidurals. It's the thing that most people are worried about, that most people talk about, and a lot of women try to avoid. It's the only form of pain relief in labour that will actually take pain away. All the other things will either help you to manage it, change your perception of it, but an epidural actually does relieve pain. The downside of having an epidural is that it does turn your labour into a very medically managed labour. You will have less mobility, you will have constant monitoring on the baby, probably a catheter in your bladder, and almost certainly an IV drip in your hand to give you fluids. You may need to have a hormone drip to augment or make your labour a bit stronger. There are no known downsides for babies for women having epidurals, except you will have a slightly increased risk of having an instrumental, a forceps or a ventouse delivery, as opposed to an unassisted birth, but you have no more chance of having a caesarean section if you have an epidural than if you don't have one.